Today we have the pleasure of having with us Valerie Namer. Valerie is an osteopath practicing here in Quebec since 2006. Her specialties or special interests are in fertility, perinatality, obstetrics, hormones, and metabolism. Valerie actually has a medical degree with a specialization in endocrinology and metabolism from France. She was director of the master's program at Haute École en Santé of Fribourg in Switzerland in 2019, director of continuous education at Centre Osteopathique du Québec in 2020. And today we have the pleasure of hearing her speak on her profession. So please go ahead, Valerie, all yours.
Thank you very much for this presentation. And I will try to share my screen if it's possible. I think I'll do that. And here we go. Okay, so thank you very much for having me today. Tony Layton was the instigator of me coming and speaking to you today. So I want to thank him, even though I think he's not here today. So I'm going to do a brief presentation and also give a little bit of insight of what's going on in Quebec regarding osteopathy. I don't know if yourself, any of you have ever used that kind of services. So I hope it's going to clarify things for everyone. So presentation is already done. So osteopathy is a traditional manual therapy, and it started in the United States under the initiative of Dr. Andrew Taylor Still, and then it spreaded to Europe and to England, and then back to Canada from France. And so as the Canadian College of Osteopathy states, it's a manual approach, and the objective of osteopathy is to restore a better function by going to the root of imbalances or pain in the body. It addresses functional difficulties and not organic problem that should be addressed to the allopathic medicine and be evaluated. So we work in collaboration. And so the only tool that we use normally are our hands. So we evaluate with our hands, and we treat, and we help the body to get back a better mobility, because we know as if we stay stuck immobile, there's less vascularization, there's more stiffness, as probably all of you have been noticing while we were confined. We get stiffer, we move less, we get a little bit heavier, and everything gets a little bit more difficult after that to move around. So that's what we do with osteopathy. So Andrew Taylor Still was a medical doctor back in the 19th century. And at that time, doctors were formed partially on battlefields and at school, but also they were alternating with a very rural life. And they were also sharing knowledge with, which was the case of Andrew Taylor Still, with traditional native medicine. And through different health difficulty, several of his children and wife had meningitis and died of it, he tried to find another way to address health issue. So he was the instigator of and the founder of the American School of Osteopathy, that is known as the AT Still University. And it was the first medical school that existed, and it is still in Kirksville, Missouri today. So in Quebec, we've been rooting because it's been over 35 years, and we're trying to have a professional order organized so that we can avoid being, we can say, harassed by the other professional orders, so the medical profession and also chiropractors and physiotherapists. So we want to have a representation, a professional representation, so that the public is being protected, because we have the need of having very clear limits in our practice, so that we practice in a safe way. Unfortunately, in the past years, it has been a little bit less of a preoccupation by the government to move this forward, but we're probably getting there in a few years, but we are very persistent and we hope that this will come forward. So we are now in Quebec, 1,700 members, and we consider there's about 20 million treatment per year in Quebec, provided by osteopaths. 1 in 4 Quebecers have been receiving osteopathic treatment at one point in their lives. And so during the pandemic, we have been recognized as essential, and we have been authorized as soon as May 2020 to go back to our offices and to work and to help people who were in need to receive any kind of treatment or relief from pain or discomfort. So on the terrain, we are useful, we are efficient, and we are appreciated, and we're used as a service by the public. The principle of osteopathy, there are 4 basic principles that we use. Is that the structure governs the function. It's like a tool. So a certain structure allows to perform certain function. And also the reality is reciprocal. If you use your body in a certain way, then you will get to a better function, more subtle, more efficient. So structure governs function, but function makes also the structure in better shape. The body has the ability to regulate itself. So it means that there's some inner tools, inner abilities that our body has to go back on itself to a regulated, a balanced state. And this is what we're going to use in osteopathy, the ability of the body, the energy, that the healing energy that the body possesses to help and support it back to its normal states. We also work a lot with improving the state of vascularization in the body, because if we get enough juice pumped into our body, then it has the ability to work better, to recuperate better, and to be more performant. And also we consider the body as a functional unit. So we tend to unify and to take the person and the body as a whole, considering that even though you may have just, digestive problem, we're going to investigate the whole body, because maybe if you also have headaches, this is linked and this goes together. So we tend to do a little bit of the opposite of specialty in medicine. We try to regroup everything and to make sense of the whole body as it functions and as it expresses difficulties, and make sense out of it for the whole person. The different type of intervention that we can do, it's with our hands all the time. And so we have hands-on contact. We can address the soft tissue through certain techniques. We also use myofascial release, so work the fascia. We also use muscle energy techniques, so referring to the muscular activity and the muscular contraction. We use contrast strain techniques, which are positioning techniques in order to release certain tension or certain reduction in the range of movement. There's also cranial osteopathy that's very often used for infants and newborns also. And we use also lymphatic techniques. So we have different ways of addressing the body, different techniques, but always using our hands. So the application field that we have in osteopathy is very broad. So usually what's best known, because of the name also, osteopathy, what we can do in the musculoskeletal field, so addressing sports injury or sports performance. So we work with athletes. We can also address visceral problem, digestive disorders, also respiratory condition after asthma, after bronchitis, after any kind of pneumonia, for instance, where we can still, as we cough very often, we can still have a lot of reduction of the range of movement of the diaphragm and the breathing. The immune system, where there is recurrent infection, see what's impairing the good movement and the good vascularization that we can support and make the symptom less. Also, a very, very broad of our exercise, and that's where I'm specializing more, is gynecology, so women's health and obstetrics. And especially we have a great deal of collaboration from the OBGY, because that's the time where no doctor wants to prescribe medication. If they can avoid it, they don't want to prescribe medication. So they tend to say, like, even though they don't always know what we do, they have their patient coming and say, well, I've been to this osteopath and really I don't have that much contraction, or my low back feels much better, I sleep better, I don't have that much acid reflux. So they tend to say, you know what, it seems to be safe. So go to osteo, they can help you. And in that way, they don't have to prescribe, and they find a solution that supports the pregnancy throughout the different ailments that happens, and that are, even though they are natural and they're frequent, they are not necessarily very nice to bear for too long. Also, we work with newborn and infants and children. So a lot of things that we do can support babies when they're having difficulty to latch, when they're crying, when they have digestive issues. So we can support that. So treating the mom and the baby right after birth gives also a very good support in providing information and making this period, which is sometimes very new and very provides a lot of anxiety, we can release that part also. And it's been very, very much true during the pandemic, where moms were truly isolated and needed that support. We can also support aging patients. The good thing also is that when we see people, we have time. We can take the time to listen to them, all the questions that they have, all the uncertainty that they have. We can support them in their difficulties and understand all what's around the manifestation and the difficulty, the pain, the discomfort. Some come naturally with aging, but also some of them can be relieved and can be supported and alleviated through very gentle manual approach, and we can provide that. So that is really very satisfactory to see people who has been, experiencing difficulty and not necessarily find enough support or have difficulty to take medication, go through these difficulties a little bit better with our help. Fertility is another category, which can be natural fertility, but also supporting all the process of assisted reproductive techniques. Also in the field of jaw difficulties like clenching, grinding, tension in the jaw and the neck, and also in mental health, being touched and supported and receiving different hands-on treatment can be completely collaborative with other approaches that can be mindfulness and psychology or coaching or that. So a lot of things can be done, and very often it's a support. It's something that's complementary and comes to bring a little bit further in the quality of life. People have pain, chronic pain, acute pain, or different elements. So there are some contraindication, and hence the necessity to have a professional orders that we protect the public. So we have to know this contraindication so that we don't provide services when there's underlying conditions that are not stable. For instance, clotting or bleeding, osteoporosis and fracture, acute surgical conditions. So in this condition, we need the doctor to say, okay, it's okay, the surgery is passed, and then you can proceed, because it does help. Acute infection, local or general, when there's an acute process going on that needs to be attended thoroughly and quickly in the medical field. This is not the time to go to the osteopath. Uncontrolled oncological condition. So if there's an ongoing invasive treatment, maybe it's not the time, but after, as a support, working on scar tissue, working on supporting the different secondary effect of chemo, for instance, but at the distance of the treatment. Also acute neurological condition, obviously that should be handled in a medical environment, and also acute cardiovascular conditions. So where does osteopathy find a place? So it's side by side, complementary to the allopathic medicine that should come first if it's the indication, and also in a multidisciplinary collaborative way, collaborating with physio, chiro, a lactation consultant, speech therapist, occupational therapist, all this profession, and nutritionist, also naturopath. We work together, and we feel the needs. So it's a really centered, a patient-centered care, patient-centered approach. Osteopathy can also be preventive. I have some people who come to see me once a year or twice a year or every trimester. It depends on their need. And also we provide coherent and comprehensive lifestyle counseling. So see all the profession that I named. So acupuncture, I forgot also. So I work a lot along acupuncturist, specifically with within the field of perinatality. So during pregnancy, helping to toward the end of the pregnancy to allow smooth delivery, right after delivery, etc. So here you have a little bit of references. And I'm ready to take your questions.
Thank you, Valerie. If we could stop share screen, thank you very kindly. Does anyone have any questions for Valerie?
I do have. What is the difference between chiropractitioner, or when should we go to the osteopath or chiropractor? Because
chiropractic have been also branching out of osteopathy, but they stay very much into more the musculoskeletal part. So they don't do all the visceral part, inflammation and that kind of thing. But it can be complementary. I have clients who see chiropractors and osteo and physio, and they kind of alternate, and they find help in combining those things. Also, chiro have been much more thorough and organized and getting organized, and they are already, professional, have a professional order, and their curriculum is taught in university. So they get a chiropractic doctor degree. And so we have a full curriculum that is ready, that will be a professional master's degree at Université de Sherbrooke. So that's what we hope for. So, but it's the choice of, some people don't like it. They don't like to be cracked, but some chiro tend not to crack anymore. So it's really a personal choice.
Thank you. Thank you, Valerie. We've got two questions queued up. We've got Jim F first, and then followed by Rod. Jim?
Thanks very much, Valerie. Am I correct in understanding that an osteopath is an MD, whereas a chiropractor is not an MD?
Actually, in the States, you have the curriculum of an MD, and you kind of specialize. Except the States, all the rest, they're not MDs. They can be, like myself, I train as an MD, but it's not necessary the case for a lot of my colleagues. So you have people who train first in physio, and then they study to be osteo or medical doctor, veterinarian, or nurses, or we have like nutritionists or different people. And they get after that the training as a DO, but there's also schools who train people from scratch, like a med school. So they get students from right after graduating from high school, CJEP, college, and they do the training, which also leads to sorry. I'm sorry, I can't hear you.
Somebody's got something in the background.
Yeah, they've got something in the
Sorry about that. I
background.
just had to figure out who it was. Sorry.
Pardon the interruption, Valerie. Did you want to say more on that question, or?
I'm good, thanks.
You're good? Okay, super. All right, Rod, you're up.
I had no idea of the range of activities that a practitioner can do. 10 of them, I think you showed on the screen. Would a practitioner specialize in only one or two of those, or would they treat all kind of tends. I mean, I see, between aging on the one hand and depression and anxiety versus obstetrics. Do you just specialize in one or two or three of those 10 activities?
So the basic training, it covers everything. It covers everything. And I think after that, certain practitioner develop a special interest, or they have it from before, a special interest for approaching certain clientele or certain pathology or certain ailments, and just kind of do more of it. So, they get more experience. And you can also look for postgraduate training that bring more insight, more new techniques, and you can also confront your practice with other colleagues. So as we are not recognized and we don't have an official program and an official structure, there's no one can really claim they are specialized. So that's why myself, when I presented myself, was I have a special interest and I do address specifically a larger number of person falling into the category perinatality, like women's health and babies and pregnancy.
Okay, thank you.
Would
Any other
the
questions?
practitioner advertise their area of interest? Yeah.
Yes, usually they do so, but as I was mentioning before, the Collège des Médecins has a technique which is going online and kind of hunting every word that can, make think that you're claiming to practice an activity that's falling under illegal practice of medicine. So if you mention a specific pathology, then you fall under this. So people tend not necessarily to advertise it this way, because in Quebec it can be tricky. So very often it's just mouse of word, and people just know I've seen this person, this osteo, and she's specifically she's wonder with that kind of category. Like for instance, handicapped children. Some people have a special interest and work a lot with autism or that kind of thing. So people tend to seek, not as it's going to treat autism, but if there is any pain or discomfort or anything that can be alleviated in the context of the autism, then you wish to be seen by a practitioner who's trained, who's skilled, who has a special interest and know how to handle the situation.
Thank you.
You're welcome.
Thank you. Thank you, Valerie. Are there any other questions, comments? No? Then I have the pleasure of thanking you, Valerie. Thank you so much for educating us, enlightening us on the subject. As you said, things are sometimes a little difficult in Quebec in terms of classifications and recognitions, but I'm heartened that over the years we've moved away from alternative medicine and understanding that it's complementary medicine. It's not instead of allopathic, it's along with. So thank you very much for all your work on there. Very happy to have you here. And we can end the recording, Heather.